Well, good afternoon, everyone. Thank you for joining us. It's a beautiful day here in California once again, and it's a shame to be inside. So we want to make sure that the time inside is spent very, very usefully. And I think you'll find that the presentation this afternoon will warrant the time invested. Very happy to have you join us, and also happy to have Joan and Dana from Kaiser to spend their time to share with us. Just to start off, I want to do a quick introduction. Joan is a senior consultant, Workforce Health Consulting Group at Kaiser, and she's been there for 3 years and is a certified health coach. Dana is also a workforce health consultant, 35 years of experience, and works with a diverse group of organizations, including public sector labor and private sector employers in the San Francisco Bay Area. So thank you, both of you, and to respect everyone's time and to tap into your expertise right away, I'm going to hand it off to you.
Wonderful. Thank you so much, Rick. And thank you, everyone, for spending time with us this afternoon. We very, very much appreciate it. My name is Joan Salemi. As Rick said, I'm a senior workforce health consultant with Kaiser Permanente. And I'm joined today by Dana Miller, who is also one of my colleagues here in Northern California. So we are going to take you through a playbook that Kaiser recently produced. It's called Planning for the Next Normal at Work. And it provides quite a bit of information about things to think about as you are returning to work and how to move forward in a very safe, effective manner. There we go. Thank you very much. So this playbook is actually meant to offer useful tools for employers as they re-enter the workplace. And our goal really is to make it as safe and supportive as possible for the employees. So as you can see, the title of our playbook is called Planning for the Next Normal at Work. And what it includes is a framework which outlines the various dimensions of health to consider in this post-COVID-19 era. It will provide guidance, recommendations, curated tools, and resources on how to safely restart work. And then finally, information on Kaiser's clinical services and member resources. Now, because the playbook is over 100 pages at this point, we strongly encourage you to focus on the chapters that are most relevant to your industry and your workplace. And just a reminder, as more science and information as it evolves, so this document will as well. And Rick, we could advance, please. So you can see from the table of contents that the playbook is organized into various chapters, and each chapter has a different focus. And again, the playbook is fairly comprehensive, addressing various dimensions of health. Next slide. We know that COVID-19 and the shelter-in-place orders have significantly impacted physical, mental, and social health. This framework was developed to help employers think about and address these various health dimensions in planning for what's next. For example, under the category of physical health, employers will need to consider workplace safety as well as testing and return to work policies. It's also important that employers consider the mental and social needs of their employees. Experts are anticipating a surge in mental health symptoms, which may coincide with the timing of returning to work. Building or reinforcing a psychologically healthy workplace where employees feel safe, respected, and empowered is more important than ever. Employers should also focus on where their employees live and their ability to meet their own basic needs, such as food, housing, job security. These factors will impact employees' health and productivity at work. Next slide. And at this point, I'm going to transition to my colleague, Dana.
As we review these sections, you can get a feel for how the playbook is laid out. We're just looking at a portion of each of these chapters to give you a good idea of what is contained within. I'm going to be spending a bit more time on chapter 1 and 2 than the other chapters because they really look at things like employee safety and screening and cleaning. In each chapter, you're going to find an overview of the issue, some market information, guidance from leading agencies like the CDC and OSHA, and a listing of resources. This information, as Joan mentioned, can get out of date quickly. So always feel comfortable in reaching out to your Kaiser Permanente representative to get the most current version. If you don't have a relationship with Kaiser Permanente, please know that an updated version of the playbook will be available online anytime you need to reference it. And it is updated about every 2 or 3 weeks with the latest information and additional information. And on the website, once you've looked at the playbook, there's actually a place where you can provide feedback or maybe something that's missing or something you want to know more about that is taken into consideration on future versions. And the COVID workplace is very different than the pre-COVID workplace. It will be an adjustment that requires everyone's buy-in, but it is critical in ensuring all employees and their families remain healthy and safe. The changes that you are making are in alignment with the majority of employers. In a recent Mercer survey on COVID-19, the vast majority of nearly 500 U.S. employers that responded are taking action to protect their workforce, like enhancing cleaning and disinfecting and providing masks. You aren't in this alone. Additionally, according to the same survey, about a third of employers are planning to perform some type of health screening on site, such as a temperature check. As you think about your workforce and work environment, consider what makes sense for you and your employees. We recommend continuing remote work arrangements whenever possible to reduce the potential risk of infection between employees and with customers. The focus of your safety plan changes should surround 3 main categories, which we'll dive into deeper. 1, employee sanitation, 2, environmental sanitation, and 3, containment strategies. We need to remember coronavirus remains a highly contagious virus, and strategies to reopen the workplace should focus on mitigating risk and exposure. And I think we've all seen that with the latest surges in different states and different areas, including California. Next slide, please. Guidelines for a safe work environment are tailored by industry. However, all industries do have similarities, which will include communicating the importance of following health and safety guidelines clearly and often. Be clear in your expectation of employee sanitation behaviors, things like physical distancing, hand sanitation, respiratory etiquette, personal protective equipment. Ensure you provide the infrastructure needed to support these expectations, like having enough sanitation supplies on hand. Be clear in what you're doing, like having to ensure a safe work environment, including environmental sanitation, and what your expectations are for employees. For example, how frequently are you sanitizing the workplace? What is being cleaned? Do you expect people to wipe down their own workspaces each day before they start working? Will you be supplying cleaning wipes for employees? How are you setting up workplaces to ensure physical distancing? Make sure to train staff on sickness containment processes. Ensure that the policies are not punitive for taking time off. What should employees do if they start to show symptoms? Who needs to be trained on contact tracing? Next slide, please. When thinking about employee sanitation guidelines, it's important to think about what personal protective equipment is needed for your workforce. PPE in a manufacturing plant looks different than in an office setting, so you'll want to define what it is for your setting and ensure you have a supply chain secured before reopening your business. Be clear about expectations for personal sanitation behavior. For example, it's one thing to say wash hands frequently versus wash hands frequently for at least 20 seconds and especially after touching boxes and being in the break room. And whenever possible, use visuals and be explicit. I am currently working at home, but I came into the office a few times and have noticed in our lunchroom, there are signs saying how many people can be in at one time. And there's also information about where to stand in the bathroom when somebody else is in there. So it's all very clear. Above the sink, there's a sign telling me to wash my hands for at least 20 seconds and how to do it. So that's just an example of that. Also being clear about respiratory etiquette and how important it is for the health of everyone. You know, the days are gone when we used to be able to come into work with a cough or allergy without, you know, it being suspect. And so making those kind of, you know, if people are sick or have any kind of symptoms, that they really should be staying home. Also have clear signage and other communication about where employees can access hand sanitizers and ensure that they can find them. And set up your workstations with adequate spacing between each station. And really important, and I think we're seeing this more as instituting a universal masking policy when possible. Also prohibiting large gatherings of people, limiting those gatherings to less than 10 people, and post and communicate how people should handle situations that would put them within closer proximity, such as if I'm going to go into that lunchroom and there's only one person in there, what is the process when I want to go in there through the door of a very narrow hallway? Should each person use hand sanitizer as they're entering? Also placing tissues and trash receptacles throughout the workplace and staying up to date on the latest CDC guidelines to ensure the safest workplace hygiene. Next slide, please. And since coronavirus spreads predominantly by an infected person's droplets of fluids released into the air or on surfaces, a well-ventilated workspace can help to minimize exposure. Allowing fresh air from outside into the workspace and the coupling of vigilant cleaning and disinfecting can reduce risks of spread. When I came into the building, both two different doors were open on two different sides. One where people went in and they were propped open all day, and one where people went out, just to allow that flow of air. Next slide, please. Now, there are many options implementing contact tracing, and we're really just starting to get our arms around this. We hear some countries are using cell phone GPS tracking for an automatic way to track people. And if they need to institute contact tracing, they already have the data, and that is extreme. I know there are other organizations in Silicon Valley and in your area, in your city, that are also developing contact tracing protocols, like phone apps. You could institute something drastic or as simple as having people track their movements throughout the day in case the data is needed. Either way, you'll want to strongly consider and implement contact tracing to limit exposure should you need to trace an infection. And right now, I was reading that the state of California is currently hiring about 20,000 contact tracers. But just to say, too, that until there is testing that has a rapid response, contact tracing is something that doesn't make as much sense as when you can get testing results quickly. And the other thing is to ensure that, you know, sick day policies are not punitive. We can learn from the Smithfield meat plant that policies to reward and encourage no sick days, although they were implemented with good intention, they actually backfired and resulted in a full shutdown of the plant. Next slide, please. So during this time of uncertainty, the importance of frequent communications cannot be overstated. As with any new protocol, frequent and repetitive communications will be critical to support employees to conform to new procedures. Additionally, you have employees who may be under additional pressure outside of work, such as struggling with family and friends who have been impacted, worried about performing well at work, becoming the only person to provide for the family. They need to feel supported at work and know that their employer cares for them and has put additional protocols in place for their safety. The communication campaign should be multi-layered and include specific steps they need to take. For example, focusing on hand hygiene or where they go for more information, such as going to their manager or a website that will be updated regularly. And use multiple methods to communicate: signs, emails, texts, and meetings. And if you have a represented workforce, be sure to coordinate and communicate with your labor representatives and leadership. Next slide, please. I know at the beginning we made the recommendation for people who are already working at home or could work from home to continue to do that. On one of the pages of the playbook is information on remote working. And there's information for employees, managers, some videos about setting up your workspace, although probably everybody already has, a little bit around ergonomics. So I just want you to know that that is also in there, and that will help to definitely reduce the risk of infection by having people stay home at least while we're trying to reduce the spread. Next slide, please. I just wanted to also point out that the playbook contains a comprehensive workplace safety checklist, and you can see what some of these items include. One recommendation, and Joan and I work with lots of groups on their wellness program, but a lot of times part of a wellness or well-being program also includes a safety aspect. So if you have a group of people who are on your safety committee, this is their topic, and they can help you to use this listing to implement a safe restart or continue to have a safe office environment. Next slide, please. This slide is a resource slide. All of these are links to materials. So there's workplace safety resources, video information series, and then fact sheets and posters that you're actually able to use on the right lower side that you could just print and put those into your workspace. They're just print and go. So that is a very useful slide. And as we are updating the workbook, we're also updating additional links and resources. Next slide, please. Okay, that was chapter 1. And in chapter 2, it covers testing and returning to work safely. We saw the government initiate some rules around sick leaves through the Families First Coronavirus Response Act, or FFCRA, which requires employers with fewer than 500 employees to provide paid sick leave or expanded family and medical leave for specified reasons related to COVID-19. It also means that if you do not fall into these new regulations, you should be looking at supporting your employees that call in sick. Do you have an emergency sick leave during this time? Maybe how flexible are these policies for leaves? And once the employee returns, what are the expectations? And one suggestion here is to maybe have a policy that there is a phone call prior to their return to work, letting them know what changes they will expect. Your managers and supervisors, they're your frontline field staff to field the questions, anxieties, concerns. And it's really important that you make sure to offer them guidance through this back to work process. And these could be daily huddles or quick check-ins, supporting them on how to best meet their employees' needs. Understanding that productivity will look different and everyone is in learning mode. And one of our VP of sales said that you're not working from home. You are at home during a crisis trying to work. And I think we all need to keep that in mind, that this is just a new time for us, and to be really generous with your employees. Next slide, please. The playbook offers guidance based on CDC guidelines for return to work for employees with and without symptoms. And you can see here, this includes timing on when employees should be returning back to work, depending on if they have symptoms, with and without symptoms, and if you're using a test-based strategy or a quarantine-based strategy. And down at the bottom is the CDC source that you can always click on to get the latest. But this information, just in terms of how much time for recovery or symptom onset, is definitely something that you'll want to keep in mind. Next slide, please. To help with testing priorities and to keep workplaces safe, establish or update your leave management and return to work guidelines. And that includes employee self-reporting of symptoms, appropriate testing, and medical documentation. And this slide lists priority groups for testing. So who are the high priority groups? We know that there have been testing shortages throughout the country, throughout the area. And these are the CDC priorities for who should be tested and so on. And there's also information on the right-hand side, a link to the latest Kaiser Permanente COVID-19 care and testing, and then information about how to get care for your symptoms. Next slide, please. So temperature taking is permitted by employers during this time, whether it's self-reported or taken at the door before the start of work. And as an employer, you can take an employee's temperature as long as all employees are subject to the same process. If someone calls in sick, you can ask specifics about their symptoms as they relate to COVID-19 only. For example, are you experiencing influenza-like symptoms such as fever or chills, a cough or sore throat? And most importantly, if you are tracking any of this information, it will need to be kept in a separate file as part of the employee's medical information and not part of their personnel file. You should follow the same guidance used for ADA requests, and there are comprehensive guidelines in the latest version of the playbook for on-site temperature screening. And just a little tidbit of information that a temperature greater than 100.4 is considered high. Next slide, please. So testing is one of the criteria for safely opening, and through current antibody studies, we know that we need more testing to have a realistic view of the spread of the virus in our communities. And there's been a lot of, we're all excited about the serology tests or the antibody tests at the beginning, but what we're really learning is that these antibody tests are useful in showing us how the disease is behaving and spreading in a population, but they are not useful in making decisions about individuals. And let me just talk about this a little bit. So the antibody tests that are available are not very good. Only a few of the dozens of tests that are being used have been quickly approved by the FDA. And even these are not nearly perfect. So in a population like ours that has a very low prevalence of disease, I read an article that about 5% of Santa Clara County was impacted by the virus. So a very large percentage of positive tests would be false positives, and we wouldn't know which ones those were. So we'd be telling people that they're positive when they aren't, and then they would believe they're immune to a virus and protected, which they aren't. So they could go on to infect themselves and other vulnerable people that they're in contact with. And in addition, you can actually test positive on an antibody test at the same time that you have an active COVID infection. And we also really don't know what a true positive test means. Because just because you have antibodies against a virus, it doesn't mean that you're immune to it. And I can provide the example of HIV. People with HIV make a lot of great antibodies against the virus, but these don't really do anything to clear the infection or protect them. And it would be reckless right now to use antibody testing to make decisions about individuals. Next slide, please. So Chapter 2 contains information about various workplace scenarios with what we call the situation, which is COVID in the office or in the workplace, and documentation issued by Kaiser is available on how members can obtain that documentation. So the medical teams at Kaiser Permanente are working really hard to treat and care for members, including providing timely and accurate medical documentation to support their employees who may need to take a leave of absence or modify their working arrangements. Understanding what to expect with respect to letters, notes, certifications, etc., as you reach out to employees will help you, your employees, and their positions during these times. So the screening and return to work policies, they're continuing to evolve as we learn more about the disease. So be prepared to monitor and update your policies as necessary. And now I'd like to transition back over to Joan to take us through the next few chapters.
Thank you very much, Dana. Although the physical safety of your employees and your workplace are top of mind, employers cannot ignore the mental and emotional impact of COVID-19 on the workplace. Chapter 3 outlines actions you can take to address a potential surge in mental health symptoms that may coincide with the timing of returning to work. It gives information on how Kaiser Permanente can support you with clinical and workforce health resources. We've also developed a mental health and wellness webinar series exploring the impact of COVID-19 on the mental health and well-being of your workforce. Next slide. Mental health is on a continuum. While some employees have serious mental health conditions that require long-term clinical treatment, others may benefit from short-term interventions or subclinical tools and resources. At Kaiser Permanente, the type of care we provide depends on clinical guidelines and best practices, along with individual needs and goals. On your screen is a list of self-care and specialty mental health services that we offer. Most of our mental health services are currently being provided very successfully through televisits. I want to specifically call out 2 new self-care apps that are now available at no cost to Kaiser Permanente members. The first is My Strength and the second is Calm. Now, My Strength is a cognitive behavior therapy app that we've used in a clinical setting for nearly 2 years along with other tools. Kaiser Permanente is now offering My Strength at no cost to adult members. And then Calm. Calm is the #1 app for meditation and sleep. It's designed to help lower stress, reduce anxiety, and more. This is also available to adult Kaiser members at no cost, and you can access both of these at Kaiser's website. The URL is www.kp.org/selfcareapps, all one word. Next slide. So Chapter 4 really focuses on the social drivers of health, and the key takeaways within this chapter would include addressing the social and economic needs of your entire workforce. We want you to consider ways to help communities where your employees live and where your businesses are located. And finally, just a reminder that Kaiser Permanente's telehealth and culturally responsive care benefits everyone, especially your more vulnerable workers. Next slide. So on this slide, we really explore health outcomes, and you can see from the figure in the center of the slide the various factors that really can influence health outcomes. So we have social economic factors, physical environment, health behaviors, and health care. When we consider an individual's health outcomes, we know that social drivers of health account for about 40%, which can impact both employee health and business productivity. These social and economic factors play a huge role in an individual's ability to meet everyday demands like food, housing, and transportation. So what matters more than healthcare? Social drivers of health, also known as social determinants of health, are the conditions in which people live, work, and play. There are things outside of the doctor's office that can really impact one's health. For example, do employees live in high-density housing where it's difficult to socially distance or self-isolate if they have COVID-19 symptoms? Do employees live in neighborhoods with limited access to fresh fruits and vegetables to maintain healthy eating and sleeping habits? And finally, do community conditions exacerbate underlying health conditions which put certain individuals at greater risk for COVID-19 complications? We also want to consider social and economic factors that people need in order to meet their everyday demands of life. The ability to pay bills or the necessity of taking public transportation to work may impact an individual's focus at work and overall business productivity. Affordable and safe childcare will be top of mind as employees return to the workplace. And when we think about furloughed and laid off employees, they may be experiencing financial strain, and low-wage workers could be particularly vulnerable. And finally, unmet food, housing, and other social needs may be more acute, especially for employees who struggle to meet these needs prior to COVID-19. We anticipate that many employees will have to prioritize their social needs over healthcare, which can be particularly concerning for people with chronic conditions. Next slide. In Chapter 5, our focus is on HR policies. In particular, we recognize that HR has a unique role in supporting employees during a time of uncertainty, changing economic challenges, and physical distancing. Local and national government policies will play a significant role in helping to mitigate the impacts of COVID-19. Next slide. So HR policies, plan documents, and protocols will also have a significant influence on assuring that your people are prepared and supported to face these challenges. By being prepared and thoughtful regarding these matters, your workers will have greater capacity to be present at work and to help you meet the pressing business challenges. This slide illustrates several areas of key focus, and you can see that we've divided it into two significant categories. The first, we have benefit plans, and then we also have HR policies and protocols. And again, it's really important that you pay attention to both of these and then update as you feel necessary. Next slide. So you may recall in Dana's presentation, she touched on communication a little bit and the importance of communicating. And I'd like to just reinforce that message by stating that you may need to rethink your current mode of communicating with employees. It may be that new channels are required or alignment with labor partners. And no matter what, you definitely want to include repetition, lots and lots of repetition. People are distracted by many demands on them at this particular time. So be patient with your employees and look for easy ways to help them find information that's relevant to their particular situation. Next slide. Chapter 6 within the playbook is focused on legislative guidance. There are a variety of changes to federal, state, and local regulations that are being implemented in response to COVID-19. And as you can imagine, these are very, very fluid. We've collected a number of these resources to help you access information and inform your own planning. Next slide. On this particular chapter, we will focus on industry spotlights. We also thought it would be helpful to highlight specific resources for industries with unique requirements related to COVID-19. In our playbook, you'll find pages dedicated to some of the unique challenges faced in returning to the workplace for industries that are listed here. And you can see that there is a variety: manufacturing, grocery, first responders. They're all going to react slightly differently given their particular needs. On the next slide, this is an example of how the content is organized. And in this case, we're looking at manufacturing. But you can see how we're really focused on considerations that can help reduce the risk of exposure to the coronavirus. And on the following slide, you'll be able to see how resources are organized for each of those particular industries. So again, we're trying to provide you with resources that are relevant. And if we could advance to the next slide. The COVID-19 pandemic isn't just a public health concern, it's an economic challenge as well. During this time of unprecedented change and financial disruption, We understand that navigating the coverage and cost of healthcare might be difficult. And as you work towards supporting the health of your workforce, whether you're continuing with the current coverage or seeking another plan to better fit the needs of your business, we'd like to make one thing clear. We're here for you, and we want to help you and your employees. Right now, your employees have a wide range of services to help ensure that they continue getting the high quality care and coverage they've come to expect from Kaiser. Our comprehensive approach makes it easy for them to understand their coverage situation, learn more about their options, and ultimately choose the right plan for them and their family. As a business owner, you also have access to online and live resources to help you stay informed and to support your workforce, both during these trying times and after we get through them. Now, for employees, we have member outreach. So whether your employees are at risk of layoffs and furloughs or have recently lost their healthcare coverage, we will proactively contact them with letters, emails, and phone calls to provide resources and guidance that can help them stay covered. To explore their coverage options or learn how to apply for financial help, your employees can use continuing coverage online tools at kaiserpermanente.org/explore options. For additional help understanding their coverage options, employees can call Kaiser Permanente's healthcare specialists. Representatives are available 24 hours, 7 days a week via our member service lines, and these representatives are also trained to connect employees to the resources that they need. Business owners can also take advantage of Kaiser's resources. So, for example, we have live and recorded webinars. These interactive forums share information and answer questions about healthcare coverage and benefits. As situations around coronavirus evolve, we're also diligently providing webinars specific to COVID-19 to discuss the latest symptoms and testing updates and help you learn how to continue getting care safely for your employees and ensuring that you're up to date on the latest information. We also provide on-demand resource libraries. Now these resources are filled with tools and tips that are available to download right now at kp.org/choosebetter. They're on demand and entirely free to all business owners looking for an easy way to share information and support the health of their workforce. And you can see the URL at the bottom of the slide here, business@kp.org/coronavirus. Next slide. So I'd like to ask you to please take a moment. On this particular slide, we're asking you to pull out your mobile phones and just open the camera and hold it to the screen. And this will take you to a survey that we would really appreciate your responses to. As you can imagine, we've created this playbook fairly quickly, and we are attempting to ensure that it is updated on an ongoing basis. And your feedback will help us ensure that we are really providing information that is timely and relevant to your particular needs. So again, we would ask that you please take the survey. The event ID is 15, and as a reminder, today's date is July 9th. And I'll just pause for a moment to give you time to scan that code. Great. I think we can advance to the next slide. So on this slide, I just want to remind you that the purpose of our playbook is to provide information, but it should not be viewed as a comprehensive instructional guide. As the pandemic evolves, we continue to encourage you to seek guidance from the CDC, your local Department of Health, and any other relevant local and national agencies. And next slide. And one more. So on this slide, we've listed a few of the questions that we've received in advance of our meeting today, and we'd like to take a few minutes to address these with you. So the first question, how is Kaiser handling the increase in the need for mental health services due to COVID-19? And Dana, would you like to take this question?
Oh, sure. So we've definitely seen an uptick in the mental health service patients, and we've been providing nearly 100% of all of the behavioral health care through telemedicine visits, either video visits or phone visits. And it's actually just drastically, increased the amount of those types of visits. And to aid in this process, what we've done is eliminated the use of written forms, and we're administering the necessary screening tools via kp.org or verbally with the member. And we're actually completing more visits now as we've seen a reduction in no-shows. Virtual no-shows don't happen as often since we moved to virtual care. Thank you.
Great, thank you, Dana. The second question that we have listed reads, when should I direct my employees to get tested for COVID-19? And my response to that question would be that most people who become infected with COVID-19 have mild symptoms and do not need to be tested. The Centers for Disease Control and Prevention, or CDC, has very specific guidelines for who should and who should not be tested. At Kaiser Permanente, we follow the CDC protocols. And while we have enough tests for members who need them and are working to increase our supply, there is still a nationwide shortage. It's essential to continue testing responsibly in all settings so reliable tests are available for the people who truly do need them. It's also important to remember that tests should come from a trusted source. If an employee needs testing, we're here for them. At Kaiser Permanente, we use tests that are approved by the FDA, plus we can connect employees to the care that they need if they test positive. There are extra steps for employees if they use a third-party vendor. The vendor can only administer the test, so the employee would then have to connect with a doctor on what to do next. Our third question states, as we return to work, what are the most important things for me to do to protect my employees? Now, this is a question that Dana and I are fielding quite frequently with many of the clients that we work with, and we do have a few best practices that we would like to recommend. So first of all, I would say instituting a universal masking policy would be a great practice. Providing at least 2 arms length between workstations, increasing ventilation and air circulation, and that would include also cleaning the screens within the air circulation system. Regularly disinfecting the frequently touched surfaces, that really is a critical step. And also educating employees about things such as proper hand hygiene and other precautions that they can be taking, what to do if they have symptoms of COVID-19, and making sure that everyone is aware of the sick day policies and procedures. And if needed, ensure that those are updated as well. The next question we have listed has to do with air travel. So what is the recommended practice for employees returning from a trip using air travel? Should they self-quarantine for 14 days, 72 hours? This particular question, it's a little bit challenging to answer. As you know, California does not have a mandated self-quarantine policy at this time, but several other states do. They are requiring 14 days of self-quarantine following air travel. So given the fact that we are not under an order in California, my advice would be to really use your best judgment. This is something that you'll have to determine on your own as a business owner, and you may want to seek legal advice. But again, at this time, we do not have a state order. And Dana, would you like to take the last question? I'd be happy to read it for you. It states, what protocols do you recommend for shared spaces like kitchens and conference rooms?
Okay, well, this is a great question, and it's really important. And as I mentioned previously about our Kaiser Permanente kitchen, one thing is to kind of scan the area and look for those high-touch areas, things like refrigerator doors, microwaves, cabinet doors where the water, when people get their water and coffee, and providing hand sanitizer. One thing I've noticed is there's these antimicrobial buttons available. I've seen them in elevators, and I've seen them on our hot and cold water. So that's something that you may want to look into. Also, removing common dishes, like you've got a stack of plates or a stack of bowls, having people have their own, bring them into the space, wash them, and take them back out of the space so that those are not shared is important as well. And, you can kind of scan your own locations and see what you might need, but maybe instead of having a coffee pot, you might have a single serving type coffee maker. In the conference rooms, really the recommendation is if you're going to have meetings, unless you have a very large conference room where you can physically distance, to maybe even if you're in the office, to have those be phone-based meetings. If you do have space, just make sure that the tables and chairs are cleaned as often as necessary. And really it depends on the use of the space for how often things need to be cleaned. And then just think about things like break rooms or storage rooms, kind of what the limit is on the number of people. And if there's somebody in there already, kind of set up process for, when that person comes out, the next person comes in. So you'll just kind of need to look at your environment in your workspace and kind of you just think in a little bit different way on how to use that space in a safe way, and providing the communication and the signage is really important.
Thank you very much, Dana. This actually concludes our prepared presentation for today.
Dana, there's one question that Ajit had asked. Can you explain how a flu shot helps with COVID-19?
Go ahead, Joan. Do you have an answer? I have an answer if you don't.
Yeah, absolutely. Go right ahead, Dana.
Well, as we're all waiting for an actual COVID vaccine, the flu shot does not protect you against COVID. However, the seasonal, between 12,000 and 61,000 people die of the flu every year in the United States. And so it's just important to boost your respiratory health as much as possible. So if you do have a flu shot, you are guarded against certain, certain strains of that virus. Also, it reduces the impact on medical services, so that if there are people with COVID or other people in the hospital, that you don't need to be one of those people there or your employees. So it really, it does kind of help you boost your overall immunity, so that, you can prepare, your body for that. Also, it keeps you at work instead of, being at home if you do have the flu.
And Rick, I do have an update for you. So I would recommend going to Kaiser's website, which is business.kp.org /coronavirus.
Okay.
And again, I will send this to you so you can push this information out to all your chamber members. Super.
Well, thank you very much once again, everyone. Be safe, have a great week, and as our presenters, Joan and Dana, both indicated, the information is changing. Certainty is one of the, absolute certainty is certainly one of the early casualties of the pandemic, and so we always have to be much better consumers of information, just because what we know is perishable, and so we always have to check. So we'll keep you updated, and thanks again. Have a great day, everyone.